Dyonics Plan provides dynamic assessment tools to virtually analyze the hip range of motion and evaluate areas of impingement, including subspine impingement. The range of motion simulations also allow you to customize your resection plan based on sport-specific motion analysis and visualize how your resection plan will improve range of motion. You can perform your analysis and evaluation using preset motion simulations, custom motion simulations you create, or by using the manual motion sliders, which are located on the range of motion screen. The range of motion simulations provide important information for checking and developing your femoral and acetabular correction simulations. Manual motions. To use the manual motion tools, change the position of the hip joint by moving a slider or by entering an angle value. For example, you can enter the hip position corresponding to where the patient experienced pain or reduced motion in the physical exam. Here, the blue areas correspond to the areas of impingement. Try returning the hip to the same position using the resected visualization modes to confirm that your resection plan eliminates the patient's impingement. Preset motions. The preset motion simulations include terminal flexion, defined as max flexion 0 degrees adduction and 0 degrees internal rotation. IR at 90, defined as 90 degrees flexion, 0 degrees adduction, and max internal rotation. Fader, defined as 90 degrees flexion, 15 degrees adduction, and max internal rotation, where max is defined as the first point of impingement between the femur and acetabulum for the specified angle. To view a preset motion, select a visualization mode for both the femur and acetabulum. Then select a preset motion. To view the entire motion, click play. To view the end position for the selected motion, click fast forward. To reset the angles on the sliders to 0, click Return all angles to 0. All angles on the sliders are set to 0, returning the model to the neutral position. The preset motion simulations stop when the first point of impingement is detected between the femur and acetabulum. The position at which impingement first occurs with the motion played is displayed here. You can select any combination of femoral and acetabular visualization modes when running the preset motions. If you view a preset motion in original mode, it displays the range of motion and any existing impingement areas before the virtual resection. If you view a preset motion in resected mode, it displays the range of motion and any remaining impingement areas after the virtual resection has been applied. After motion simulations are conducted, you can observe the projected improvement in range of motion as a result of your resection plan in the information area at the bottom right of the screen. Custom motions. You can create and view your own custom range of motion simulations. There are two types of custom motions that you can create: impingement and define position. To create a custom motion, you set the values for the 3 joint angles. When creating a custom motion, use your clinical judgment to define realistic motion patterns based on each patient's activity level and usage. To create a custom motion, select New from the Custom Motions field. In the Custom Motions field, enter a name for the motion. In the Custom Motions Selections area, for each joint angle, do the following. Select a direction. Either enter an angle value or select max range. Click Save. The custom motion is created. If you select max range for one of the joint angles in the Custom Motions area, you will be creating an impingement motion. This causes the hip joint in the simulation to continue to move in the direction specified until the first point of impingement is detected between the femur and acetabulum. To create a defined position motion, enter an angle value in the Custom Motions area for all 3 joint angles, with no angle set to max range. This causes the hip joint in the simulation to continue to move until it reaches the defined position, independent of whether Dyonics Plan detects an impingement between the femur and acetabulum. If impingement occurs, the impingement regions are marked with shaded blue areas. To view a custom motion, Select a visualization mode for both the femur and acetabulum. Select a custom motion. To view the entire motion, click play. To view the end position for the selected motion, click fast forward. If you view a custom motion in original mode, it displays the range of motion and any existing impingement areas before the virtual resection. If you view a custom motion in resected mode, it displays the range of motion and any remaining impingement areas after the virtual resection. To edit a custom motion, select the name of the motion to edit from the Custom Motions field. Click plus to view the angle settings. Make the desired changes for this custom motion. Click Save. To delete a custom motion, select the name of the motion to delete from the Custom Motions field. Click plus to access the delete function. Click Delete. The custom motion is deleted. For more information, visit DyonicsPlan.com.